for those wanting to get into medicine, particularly the physician route. I would say really understand why you want to do it. I would start off by saying, for money is not the right answer. Not just because it's not an ethical reason, but honestly, it's not even a practical reason. When you consider the hundreds of $1,000s in debt, the average medical student is at least $200 to $250,000 in debt graduating from medical school. It's usually in your 30s on average when you're finished with training. So you're starting at least $200,000 in debt, negative, in your 30s when there's so much to play catch up on. You may want to try starting a family or getting a home and so many other things. So it's not for the faint of heart, and it's not a quick get rich quick method at all. Particularly the amount of work and sacrifice, missing so many birthday parties or opportunities to see family members because you have to work or you have to study.
The other question is that do you think these number of years are needed for physicians? And do you think that because of the long amount of years that's leading to burnout quickly after physicians become attendings and they go into the workforce and they've already spent 10 years of their life
Mhm.
um, with a lot of frustration, a lot of challenges, lack of sleep, not taking care of their health, postponing their personal life, not having families, not having homes, not having a lot of support. And then, so they're already burnt out when they finish after
Right.
all those
Yeah.
years. And then the mindset is that there's a light at the end of the tunnel, but we all know that's not the case. It's a dim light, if anything. Yes,
Yeah.
it's better, but
Right.
it's better. But now you have other responsibilities. The expenses uh, get significantly higher because then you have, you're doing family planning, then your wedding, for example, you'll have all the expenses that you put off to get that big paycheck. And then you have to pay off your loans, and the job doesn't get easier, right?
Right.
The job is
Exactly.
still, you have more responsibility. If anything, your patients now relying on just you can't take that much time off. Like, I used to think, okay, after, in residency, I can take time off like 4 weeks from my elective and vacations to have for delivery. But
Mhm.
then my friends who were already attending told me that don't think it's going to be better and you can take more time off when you
Yeah.
are attending.
Exactly. Yeah.
That's not the
Mhm.
case.
Mhm.
So the question is, really, all those years are they needed? All those years, like 4 years of college, 4 years of medical school, and then some 1 year or 2 years gap. Some people take to do research to put more on their CV and resumes to be more a stronger applicant. And then you have the residency, and depending on what residency wants, what specialty, then more years are added and fellowship added. And then some people go into clinical instructors or chief year. So it's just, I feel like we're adding
Yeah.
more years.
Mhm.
And then we have APPs on the other hand. They are going into practices and even specialty practices right
Yeah.
after just very minimal years of in
Mhm.
training.
Mhm. Yeah, no, I totally agree. I do not believe all of the years are necessary, especially when it comes to the undergrad years. There are a few programs at least that where you can do 2 years of undergrad and go directly into medical school. For instance, in England or with the British system, in many places in the Caribbean, you go directly from high school to medical school, which is
Many
five
other
years.
countries, yeah, many other
Many
countries,
other countries,
right.
absolutely. I think the US is maybe Canada's just one of the few places in the world that does this. Of course, the advantage is if you are not sure what you like to do, and an undergrad helps expose that. But if you know you want to become a doctor or go into medical school, it's not necessary. And then, of course, medical school itself. If you do have to end up specializing, do you need to spend 2 years doing rotations or 2 months for certain rotations when you're going to be spending a lot more time in residency perfecting that or that specialty? Then, of course, there's the question of whether residency in itself needs to be as long as it is. And of course, that's debatable. But as we mentioned earlier, I feel with the number of cases that we see in residency, I now have become a lot more comfortable seeing patients with certain neurologic disorders. I could not imagine not having that experience. And I do see where there's some APPs who have, it's evident, again, has nothing to do with their intelligence. It has to do with exposure, right? So if someone is not exposed to a particular subspecialty or specialty, I mean, just or barely, how, to then practice entirely independently in a subspecialty area, it's challenging. So, but many people, many do adapt. So then the question is it necessary, which yours is a valid one for all of these years of training? I do feel that it certainly can be condensed. I'm not sure the exact method to doing that. One certainly would be undergrad. If someone is certain that they want to get into medical school, then not as many years of undergrad should be needed. But of course, we all know it's so competitive as well to get into medical schools. So that's another issue. What would differentiate some people from others? And that's where it comes in with the research and all of these things, publications that set people apart, even within medical school and getting into residency. There's some residencies which are a lot more competitive, and some people may have to do a lot more research while they're in medical school to try to get into these competitive specialties. So ideally, it should not be that many years, and I don't think it should be. But I'm not sure how to change it. Perhaps lobbying and policy would help, but there's so many factors that go into this.
I think you hit the nail on the head on several instances. One, the emphasis that it's not a reflection on anyone's intelligence, right?
Yes,
Because I think when I am online and I'm seeing MDs and nurse practitioners arguing, it ends up being almost like an ego contest, like we're
right,
saying we're better than them. It has nothing to do with that. You can
correct.
be
Yeah,
the smartest person in the world,
absolutely.
but if you don't have the experience, you don't have the experience.
Just
It's like I'm not going
experience.
to go work for Google tomorrow. I don't have
Right,
the experience.
right.
So that's really it. And then the second thing is I agree with what you and Shala both said. I don't think medical training needs to be this long. I think we can cut undergrad out. Quite frankly, I don't think I got much out of my undergraduate experience. Some people, they are not specialized. They major in other things like computer science or engineering, so they have a degree. My degree is
Mm.
not that useful, and I don't think it added much. And my degree is actually neuroscience because I knew I wanted to
Yeah.
do neurology early on.
Mhm.
So we could totally cut that out. I think when it comes to rotations, there is some utility in rotating in different specialties just to get an idea, but maybe not 2 full years. Maybe we just do the core rotations and let people decide because pretty quickly if surgery is for you or not for you. You know
Exactly.
what I mean? So all of those things I think are very valid and I agree with. You mentioned lobbying, and I think that's a great segue to discuss that because I think the one thing we've seen with APPs and even PAs to a certain extent is they're very good with collective advocacy. They support each other, they lobby, they unionize, and I think we're also seeing residents start to do that, which I'm very happy about because Shala and I have emphasized that there's no way we're going to make any change unless we all come together because we're all in the same boat, unfortunately. And I don't think doctors are as collaborative with each
Mhm.
other as APPs might be.
Yeah.
I know we've discussed this offline too, Wendell. Initially, when you start seeing APPs or CRNAs making certain salaries, your first instance is like, what? But then
Mhm.
you're like, well, good for them.
Yeah.
They're making it happen,
Yeah.
you know? So, what do you see in terms of the future of medicine? Like, how do you see things changing in the next 10 years? And do you have any specific recommendations for young doctors or even med students or even undergrad people who are thinking of entering medicine? I personally think unionizing is going to be a positive change, but if there's any other added advice that you can offer to people who are thinking about even entering medicine.
So, gosh, the future of medicine. We are here in 2025, and it's all about AI, artificial intelligence. I think it has already started to play a huge role in medicine, in every specialty, every subspecialty. Gosh, some people are even using AI scribes now, where we talking to there's a program and just listening in on the conversation. That is, of course, it has to be HIPAA compliant, and it comes out with the well-written history, differential diagnoses, different possibilities of the issue, as well as a treatment plan. So that's already happening. So the future of medicine, it's interesting. There's several things, and of course there's the AI, but then there's also reimbursements, and insurance companies are trying to reimburse less and yet less and deny more and more, right? We see, I mean, we all are aware of what's going on with some of the big insurance companies and doctors who are seeing it on social media platforms of how companies deny patients just automatically. Sometimes it's not even a person on the other end, it's an algorithm, a robot or AI that's actually denying patients' claims. Uh, so that is a huge part of medicine, and it's only getting more and more challenging, not just for physicians and taking up physicians' times or clinicians' times, but for the patients themselves. They are paying to to have their health taken care of and paid for. And you have so many insurance companies who are denying payment for necessary treatment. So that is a huge challenge, and it seems to be getting worse. And I think part of the issue is just talking about it more and more. There are a lot of doctors, a lot of clinicians who are now speaking more about it on social media platforms, and hopefully that can somehow get its way into a change in policy. But as we know, money and finances run the world in many respects. So that's also there's so many other factors that come into denial and when it comes to claims. Then, of course, with AI, as I mentioned, what role is that going to play? And I fear, of course, there are advantages to that, where I feel it can be a good aid in getting information, but AI is not perfect and it can hallucinate and come up with wrong answers. And there are issues with the judgment, right, of AI and the art of medicine, because there's a lot of the things that we can know as physicians or as clinicians, but when it comes to the art of medicine, where there aren't necessarily there are two right answers, one might be better, or you have to consider other aspects of someone's clinical history before making a recommendation or trying something. And then, of course, there's the whole experience, the human experience and our intellectual experience that comes into play. So the future, there are a lot of great things. I mean, even just research and the path for a lot of discoveries. Certainly, there are now challenges with the federal government with being reimbursed for certain things based on the administration. There's some projects that are not being funded, some projects that are underway that aren't continuing, unfortunately. So there are those challenges as well. But I do believe, on a whole, I'm hopeful that there'll be a lot more cures for diseases that we don't currently have, a lot more treatment for chronic conditions that would help improve compliance. And it may not be as challenging as it is currently. With AI, the lack of and telemedicine, right? The lack of face-to-face human interaction. Granted, yes, it can be via web, but I think there's something to be said for in-person connection. So I'm not sure how all of that is going to play out, but I do believe that there would be challenges. Now, I do think one of the questions you asked me was advice that I may have for someone wanting to go into medicine or who is already in medicine, but especially for those wanting to get into medicine, particularly the physician route. I would say really understand why you want to do it. I would start off by saying, for money is not the right answer. Not just because it's not an ethical reason, but honestly, it's not even a practical reason. When you consider the hundreds of $1,000s in debt, the average medical student is at least $200,000 to $250,000 in debt graduating from medical school. Later on, it's usually in your 30s on average when you're finished with training. So it's like you're starting at least $200,000 in debt, negative, in your 30s when there's so much to play catch up on. You may want to try starting a family or getting a home and so many other things. So it's not for the faint of heart, and it's not a quick get rich quick method at all. particularly the amount of work and sacrifice, missing so many birthday parties or opportunities to see family members because you have to work or you have to study. But if you do realize that this is the path you want to take, there are other areas in medicine. There are physicians, but there are the nursing route, there's the pharmacy route, other routes that may not require as many years. And of course, you mentioned earlier, Santoshi, some CRNAs who do anesthesia, they get out, they come out making in the hundreds of thousands, sometimes even more than some specialties in medicine. So it's important to really explore the medical landscape and do not do it one just for the money, but also don't do it because you feel pressure from family. That's a horrible, horrible reason to become a physician because it's not going to be if you're doing it just to please someone else or your parents or something, you're going to end up with a lot of resentment and a lot of regret because of the amount of sacrifice that it takes. And then once you do get into medicine, you figure out that's your path. You get into undergrad and medical school, then certainly seek mentors, people around you that you can trust who've walked the path before, because there are also going to be certain residencies that may or may not be suitable for you. Santoshi mentioned earlier, you know whether or not you want to do surgery or not surgery because of the grueling hours. Now, granted, all of medicine is a lot of hours, but there's some that's a lot more grueling than others. So getting as much information as you can so that you can make an informed decision and one that you won't have regret, or at least a whole lot of regret when you are on the other side of that.
You brought up great points. One is pressure from family, and the other one was that basically not having tunnel vision, that this is what I'm going to do and I'm not going to explore any other option. I feel that some of us kind of had that because nobody really talked about loans or the challenges, the sacrifices that much because it was less back then, because
Yes.
I remember when I started kind of doing getting exposure, and I went and worked for a practitioner, an internal medicine practitioner, as a medical assistant to get the experience so I can put it on my resume for my medical school applications. That person did not have any loans. It was a practitioner, and they told me, "Don't worry, you get a lot of money afterwards." And so it was changed. This has changed even when I was a undergrad and just entering medicine. In the past 15, 20 years, things have changed to the worse, right? The tuitions are higher, the medical school debt is higher, the reimbursements are lower, physicians are not getting paid, physicians becoming more and more employed, losing their autonomy. Private equities are playing a bigger, significant role in how much physicians are getting paid. So a lot of challenges that have quickly accelerated in the past 10, 15, 20 years, that the advice that we got, I don't think it was the best advice.
Yeah.
And this is what I will tell medical students these days, that, don't listen to one advisor. Explore your options and talk to as many people as you can in different fields. And even as physicians, just talk to as many physicians in different specialties as you can. Network, because to just understand, one person may be happy, but 10 other people may not, or 10 other people may be happy, or one person may not. So you really need to explore all the options, talk to everybody, and understand what's going on, understand the bigger picture of where we're headed. So, and this is a question to you. What do you think the one thing that you can change in the healthcare system for a better future for all the doctors and healthcare workers?
Oh, that's a loaded question. But if it were one thing that I can think of right now, it would be
Could be a few things.
but what we value, right? I feel right now the healthcare system, as you all have mentioned, not just most doctors are not just employed, but it's employed by people or corporations who don't really understand medicine. And they tend to value volume over quality. Okay. And that's something that really is important because they want literally to see one follow-up patient in 10 minutes or so, or sometimes in some cases 5 minutes, or maybe double book patients for 15-minute slots. How on earth can someone really delve into a true issue problem, even if it's for follow-up? Something may have changed in that condition. Okay. So this is really critical that I'm not sure how it's to be done. I believe lobbying is, at least in the US here, that's probably the main way, everyone coming together and doing that, because that's one of the biggest challenges. And it's for patients as well, because patients think doctors, they just want to get them in and out. Patients may complain that the doctor is not taking enough time with them. The doctor doesn't want to hear of a new medical issue, and it has nothing to do with that. It's the fact that physicians are given limitations on how much time they're allowed to spend with one patient. And if when you think of like 10 minutes, you have 10 minutes not just to see the patient, but to get the history and document it, okay, with the right billing codes to get reimbursed so that the physician or the practice can be a viable practice. So I think that is what is one of the biggest issues, valuing volume over quality of care. And I am not sure exactly how that's going to change, but I believe the more we speak about it, you're having this podcast, and people talking about it on social media and really understanding that pressure should hopefully start causing some type of change, because it cannot continue in the direction in which it's going.
I agree, Wendell. I think right now, the way things are going, it's unsustainable. But at some point, we'll see a plateau, and we'll see a downfall. And I am worried about it because we're getting older, our parents are getting older. Who's going to take care of us?
Right.
If people just don't want to enter medicine, I don't blame them. I personally have been recommending PA school for a lot of people. I'm like, if you really, really can't think of anything else you want to do healthcare, consider being a physician's assistant or a physician's associate, they call themselves now. But it'll be interesting to see where things are headed. In our last few minutes, I was wondering if you could talk a little bit about your social media, what inspired you to start it, and where people can find you.
Sure. So I started Instagram page with where I talk about sleep and sleep disorders. And the reason that I started it is so many people aren't aware of the importance of sleep and how sleep can affect other parts of their health. So sleep, for example, insomnia and sleep apnea. These are risk factors for strokes, for heart attacks, for cardiovascular disease, for certain pulmonary disorders, even diabetes. We now know Alzheimer's disease. So people simply aren't aware. Like, people think snoring is normal. My mom snore, dad snore, grandmom, granddad snore, and they're just a snorer, not realizing that that can be an indication for something much more serious, such as sleep apnea, where someone stops breathing in their sleep, and that causes a cascade of issues with increased blood pressure, uncontrolled hypertension, which can lead to damage of the arteries, and of course that can then lead to some of these other cardiovascular disorders. So I wanted to help people understand that, because there's been this feeling in throughout for many centuries that if the less sleep you get, the stronger you are. The less sleep you're able to operate on, the more resilient you are and you're a better person. And that is just very damaging. Not only is it not true, but it's just really damaging. You're lessening your quality of your life, and perhaps the quantity, how long someone may have to live. And I found that not too many people were talking about this. And the reality of it is, and the reason for that probably is, sleep medicine is really one of the newer specialties. It was only in 2007 that it really became a formalized specialty that you can sit boards for, write exams for, and really formalize. Yes, sleep medicine has been around for quite some time, but not compared to many of the other subspecialties. So that's probably the reason why, when we were growing up, no one was talking about sleep medicine, and it just wasn't a thing, right, for people to get sleep apnea treated. And so I really wanted to educate the public, and I am doing that primarily on Instagram at Dr. Bobb MD, so Dr. BOBBMD. That's my Instagram handle, and B. I'll say it again. DR and then B as in Bravo. O Bravo Bravo MD. Sometimes people aren't sure if I said a B as in Bravo or D as in David. So, and yeah, so I will, when I can. It is challenging. I know, Dr. Billicourt, I don't know how you do it to provide such frequent. We're talking about this, such frequent content. It takes a lot of work and to produce, but obviously, you're helping so many people. I know you do seizures, and you help so many people, and I'll try my best to certainly keep it up with teaching people about sleep disorders. Right now, I'm talking about insomnia, which affects about 30% of the population at any given time, and treatment for that. So thank you.
I think your social media is great. It's very
Thank
well
you.
produced and
Thank
nicely
you,
put
Dawn.
together. I hope you continue doing it.
Thank you. I'll definitely do that.
I'm sure there's more. We always
can bring
say
it back.
this. Yeah, we can
Sure.
bring you back. There's a lot to talk always.
Absolutely.
But it was very nice. Thank you so much for joining us. Thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.